to shift gears here a little bit into the medical world because we're looking at massive increases in insurance costs, some of the greatest rises in 15 years, and yet we're still not getting price transparency out there either. I wanted to talk about this with Cynthia Fisher, who is the founder and chairman of Patient Rights Advocate, PRA. How you doing this morning, Cynthia? I know you're in a
great, Bill.
You're in a corridor over at Capitol Hill somewhere, trying to stay quiet, right? That kind of thing.
Yeah.
Hey, tell us a little bit about Patient Rights Advocate. What are you doing there? What's part of your group?
Yes, our organization, well, we're here in Washington, and we are advocating for prices in healthcare so that every single patient, every single American can know what are they going to get in healthcare and what is it going to cost them. And we are very glad to say that in the first Trump administration, that President Trump made it into law, giving us the right in a bipartisan way to be able to see all prices in healthcare from hospitals and insurance companies. Unfortunately, Bill, what happened during the Biden administration is they rolled it back to be estimates and algorithms. And people don't do complex math and calculus to try to find the price.
Okay, so the law said that we were supposed to have the prices. So when you say that it was an estimate and algorithms, how did that look then if you were to go to a hospital website or a clinic's website and try to get a price on something? What happened?
Well, I'll tell you, Bill, when you go to the hospital pricing files, they're a mess. It's complex math and calculus, and a lot of them don't even add up to a true dollars and cents price. So we know that the hospitals are gaming and obfuscating, getting true prices out. And we're glad to say that coming out of the gates, this new Trump administration demanded radical price transparency, giving everybody access to actual prices across the industry starting next year. So Right now we had a bit of a rollback, a mess, and what I can tell you for Oregon is, unfortunately, as we look at compliance, because our organization is focused on making sure everybody has access to prices in healthcare. Why? Because if we can get our MRI in advance of care, get to know what the price is, well, then we're going to know exactly what we're going to pay. And so people can then shop to make sure they get an MRI nothing more than $300 rather than being charged as high as $7,500 in a major hospital for this very same quality read of an MRI.
I have to tell you, we had experiences like that with my own family, in which shopping around with a MRI, the hospital was just, I want to say the hospital was $1,800 for the particular scan they were looking for. And we were able to get it outside of insurance here at a Southern Oregon clinic for about, I want to say $350, $400 at the time. There's a huge difference. Huge difference.
Huge difference. And that's real money. And look, what we're finding, we just did a 7th annual report looking at the hospitals across the country. We're finding that there is such wide price variation because prices have been hidden. Even in the same hospital, Bill, we've seen a variation in prices as high as 40 times higher from one insurance plan compared to another. We've seen prices across hospitals vary even more. So when you see that prices vary because they're hidden in the shadows, nobody can actually see what is a fair market price. But God bless you, because your family did the hard work and found out by paying cash money, you could get an MRI for $350, right, at a standalone center rather than paying over $1,800 in the hospital system.
Here is the biggest problem that I'm having, though, with it, and that is the special deals that all these various insurance companies end up cutting with hospitals and perhaps doctors' groups or whatever it is. And I don't really know what the real cost of something is at this point. Is this anything which is addressed in President Trump's any President Trump's bill? Because most of us, if you have employer provided health care, that kind of thing, or you're buying it through them, you have some plan, and the plan has a rule, and then you have Blue Cross or you have Anthem or somebody else. They cut the deals. You don't know about it. You don't really know. And it's next to impossible to try to find out, what does an appendectomy really cost? Well, I can tell you what happens after all the deductions and exemptions, and what about your personal copay and all the rest of it? It just turns into this nonsense of mush, I guess, is what I'm getting at here. What do you think?
Well, absolutely. And the reality is you, the patient, all of us as patients and our families are the true purchasers, right? And when we have insurance, we share coverage with our employer.
But the system, though,
part of it.
Okay, well, I'm sorry to interject here, Cynthia, but the system is really, I mean, we might be paying the money or being part of it, but we're not really considered the purchaser of the services as far as I can tell, because it always seems to be the insurance company that ends up being the purchaser and decider of the coverage.
The reality is it's not the insurance company's money. It's the money that we set aside to pay for that premium that comes out of our paychecks and comes out of our employer earnings. So the reality is we are the true consumers. We are the true purchasers, and they're just middlemen. And all they do is administer the bills. And this is the reality is we're really pleased to tell you that the insurance carriers and the hospitals, in the radical price transparency executive order, starting next year, they will have to pull back the curtain and show all of the actual prices. Now, there's another major law that happened during the Trump first administration that this new administration is going to make into practical rules of law, and that is prices first healthcare. So starting next year, the administration is going to come out with making sure whenever we get scheduled or planned care, we will have our exact price. So we'll have what are we going to pay out of pocket, what's our copay, and what is the amount total that the hospital is going to charge. Now, we'll have that before we even go in. Guess what? We're also going to have the ability that the administration's demanding that all actual prices be in dollars and cents and be provided online from the hospitals and the insurance companies. What that means is you and I, at some point in the not-too-distant future, will be able to use something like ChatGPT or go online or Google and search what is the fair market price in Portland, Oregon for a colonoscopy.
Okay.
And what are the price variations? And what is my plan price before I go in and schedule it? And so some people are going to see that their plan price is $1,200 all in, and another patient will see it's $12,000. Well, I'm going to tell you what's going to happen is the patients that see that they're overpaying by over $11,000, that they won't stand for it and they won't tolerate being overcharged. And what will happen is we'll have competition and consumer choice to say, wait a minute, if I, like you did for your MRI, you went and got it at a far lower price. If I demand to get a fair market price or go elsewhere and shop with my feet, then I'm going to demand driving down the cost of health care. And then also, Bill, when you get your bill, right? You get your bill, we should have an itemized bill to make sure it is exactly what we did get and receive. Just like when you go to a restaurant, right? If they charged you for the wrong thing, we should get credit for that and not accept. And so prices give us remedy and recourse if we've been erroneously or overcharges or upcoded.
Cynthia, you have a report about this over on your website, patientrightsadvocate.org, that is really worth reading. This is good news then, what I'm hearing from you. I don't know if the laws or the executive orders address something else here. When you do purchase outside of, in other words, I don't do the MRI through the hospital, but it doesn't go through the insurance company either. They have no, billing with this. The claim is that you have not spent money and it doesn't meet your deductible. Is there anything about it in which outside money, outside of the medical industrial complex system of the insurance company, should that when you spend to get the least amount of money for the same care, that it should at least count on deductible issues? What do you think?
Absolutely. And we're fighting for that in Washington, that when consumers like yourself are able to find something so much lower cost and pay cash, that should count toward their deductible because they're saving the entire company or the school district. They're saving money by all of us becoming consumers. And so those incentive systems can be built into the health plan that the employer has. And oftentimes, because the big healthcare industrial complex makes more money the more they hide prices and charge in the dark, well, they object to it. But the reality is it's our money, it's our lives, and these are our finances. And so what we do find is that school districts or public sector states that run health plans or employers in the private world who design the health plans and reward people, some of the plans we've seen will say, not only will we allow that to count towards your deductible, but we'll actually pay for it all because you save so much money for our health plan that you're saving all your fellow members of this plan the ability to lower our cost of premiums in the future. So they'll even do incentives for getting a knee replacement at a price-transparent surgical center that guarantees a knee replacement for under $15,000 versus going to an opaque hospital system where the same quality of care may end up costing $100,000. And so oftentimes we've even seen employees in a good plan design get a $2,000 bonus and free transportation and transportation to rehabilitation and no copay and no deductible when they go to designated quality care centers at guaranteed lowered prices.
Okay, that's good because it would seem that there should be an encouragement of having less money. Up to this point, though, if it didn't go through your insurance company, it's like it never happened. You know, in other words, if they weren't handling the money and getting their cut, then it didn't count as health care spending. See what I'm getting at?
Absolutely. Absolutely. And that's because the insurance carrier is really the middleman. And you, the consumer, out of your paycheck and out of your take-home budget, and as the employers out of their earnings and their budgets, are the true purchasers of the health care. And unfortunately, you know, insurance in the shadows, as have the hospitals, they've had us blind to no prices, blindside us, and then expect us anytime we get care to pay a blank check, whatever they choose to charge us. Well, it's game over for that archaic way of overcharging the American people. So, we believe very firmly that you're going to see substantial changes to having radical and actual price transparency starting next year and in the following year, that we will see prices first healthcare and protection of patients from overcharged medical bills.
All right. Well, good news. I'll take the good news where we can find it because I can't think of one issue that's had more calls and letters about the incredible frustration and strain of dealing with what does something really cost out there. And for this, I'm grateful. All right.
Exactly.
All right.
Exactly. And Bill, everybody should feel free to come to our website because nearly everyone has a story of being overcharged. We had a young man who had a $15,000 charge for an EpiPen. And because we've helped him find the actual prices, he was able to get his bill totally wiped clean because the hospital way overcharged him. So they can come to our website at patientrightsadvocate.org, patientrightsadvocate.org, and we will show how to fight medical bills. Don't pay the first bill. Make sure you fight and make sure you get an itemized bill and that you agree with it. And then also how to shop in advance in these difficult times while the hospitals are still gaming and obfuscating. But we will help, and we show the way, and stay tuned because good news is coming. Good news is coming by law to get actual prices and prevent overcharges and lower our costs.
Glad to hear it. Cynthia Fisher, once again, founder and chairman of Patient Rights Advocate. We'll get all that information up on KMED.com. Appreciate the talk. Thanks for being flexible on the talk.
Thank you.
Okay? Bye-bye now.
All right. Thank you.